ولا عرفت هدايا ولا عرفت ظلامي
It is 11:11 on this Wednesday, the 3rd of March 2021. You are listening to the Mid Morning Show with your host, Mario Mukwanda. World Tuberculosis Day, which is observed on 24 March every year, is designed to raise awareness regarding the epidemic of TB and efforts of eliminating the disease. In the year 2012, a total of 8.6 million people were sick with TB. 1.3 million people died of TB, of the infectious disease, and these were mostly people in a third world country. To chat to us about TB Awareness Month and the impact of COVID 19 in managing TB in South Africa is Malesela Maporoma, who is the wellness coordinator with the South African National Tuberculosis Association. Good morning, Malesela.
Good morning and good morning to your listeners.
Thank you for joining me this morning. So, many people are familiar already with TB or tuberculosis, but for those who may not know or have an idea, can you please tell us a little bit what TB is about and how does it affect the body?
TB is a disease caused by a germ called Mycobacterium bacilli. So Mycobacterium bacilli is an airborne disease. You can inhale it anytime, and it can affect any other person, rich or poor.
And how does COVID 19 affect patients with tuberculosis?
Um, if you look at COVID-19 and TB, most of their symptoms are the same. But because of the restrictions, TB infected people were compromised in three categories. The first one was that the movement were limited, so they were unable to go and collect their medication, or they were delayed to go and collect their medication. The second one was that people who suspected that they've got TB were not able to go to the nearest clinic to be tested, which means early detection of the disease was compromised in some cause. And the other one is nutrition, where people were not able to be able to go and get a proper nutrition
Yes.
for their daily survival. So we all know that you cannot take an antibiotic or a drug on an empty stomach. And people, most of our clients, day retailers, they go to the street to hustle, but in some instances they were unable to go and do their daily activities that brings income for them. So COVID-19, even the resources from our South African government were channeled more into COVID-19 than into other diseases. So people who were infected with TB, or people suffering from TB, were not receiving much attention as they should. We know that we were in a panic mode, but at the very same style, we were obliged to manage the diseases that were already there. So in some instances, in this case, TB was compromised in a lot of ways.
And since it was compromised, did it worsen the condition of the patients?
Yes, in quite a number of patients, especially those that we were in contact with, some of them left medication, and some of them were, they physically lost weight, meaning they were from being mobile to being bedridden. In some instances, they could not finish their medication, or they could not adhere to that treatment because of the situation that is compromising them.
Mm-hmm. Wow, it was indeed a terrible situation. And how has that problem been resolved, or is it being resolved?
Um, I cannot confirm that it is being resolved, but we can only say that we deal with it as it goes.
Mm-hmm.
If we find that a TB patient is suffering from, I mean, they are emaciated, we try and refer them to proper resources, or maybe to try and give them the food supplement. We do have
Mm-hmm.
food supplements in our offices where if a patient cannot take solid food, we try and give them a porridge or something that can give them daily nutrients for them to be able to take drugs, TB drugs, or for them to be able to do other things that they need in their environment.
Mm-hmm. Can one get COVID-19 while on treatment for TB? And if so, how should it be managed?
If we look, we first need to understand what COVID-19 is and what TB is. There are two different germs.
Mm-hmm.
There are two different viruses. So if one is infected with TB and taking TB treatment, that does not automatically mean that they are immune to TB. To COVID-19.
Mm-hmm.
So yes, they can get infected with COVID-19, and even a COVID-19 person can get infected with TB because their treatment are not the same, and the treatment of TB is not effective into curing COVID-19. So it's two different diseases. They might have the same symptoms in some instances, but they are two different viruses.
Mm-hmm. All right. March is TB Awareness Month. So, why is there a need for us to have this Awareness Month, especially in South Africa? Can you share with us some numbers of TB and how it's being managed?
Okay, if you look at the March month as it is as TB,
Mm-hmm.
yeah, or in a TB spectrum, um, TB was discovered in March by Henrich. Um, and in that instance, on this month, it was then declared that the world will celebrate the discovery of this disease.
Mm-hmm.
And remember, now we discovered, COVID-19. Obviously, every month every year, when the time that we discovered COVID-19 comes, we need to
Yes.
celebrate that we discovered our enemy. And as we look at, I'm not sure about the numbers at the moment, but I will
Mm-hmm.
share as soon as I can get in contact with them, or maybe be able to see how many people are infected at the present moment.
Mm-hmm. All right. So, and access to healthcare has currently been compromised due to the COVID-19 pandemic. But prior to that, how has that been in South Africa? Is it easy for TB patients to access healthcare? Is the healthcare improving, or are there new TB drugs available to make the treatments faster or help even better than before?
Okay, the basic line is, um, if a person is infected with TB, especially an ordinary TB, we've got about three forms of TB. It's a
Mm-hmm.
multi-drug resistant TB, it's extreme drug resistant TB, it's a normal TB. So if a person is infected with a normal TB, the duration of taking treatment is still 6 months.
Mm-hmm.
Um, all those medications that are coming in line are still on trial, and we cannot now confirm that they are this way. So for
Mm-hmm.
now, taking treatment is 6 months, and making sure that a person takes treatment, we need to understand that it is just 6 months.
Mm-hmm. All right. So, what is the theme for this year's Awareness Month?
Our theme is TB is curable at Santa, and we're trying to encourage people to take their treatment and making sure that we can beat TB.
And are there any events of note that people can participate in?
With the COVID restrictions, we are only able to visit companies with strict precautions. We don't have street events. We don't have outside events. So we are only into media. We are only into visiting companies because we know that they will be able to control, to put in place the COVID-19 precautions. But with us, the normal event that we used to do, the normal walks that we used to do, this year we've put them on hold, and we hope next year will be better.
Yeah, hope so. Everybody's hoping that this will be the last year of the pandemic. All right, so thank you so much for your time, Malisela, and have a wonderful day.
You too, man. Thank you.
That was Malisela Maporoma, the wellness coordinator with the South African National Tuberculosis Association, taking us through TB Awareness Month, which is the month of March, and specifically it's going to take place on the 24th of March, and also the impact of COVID-19 in managing TB in South Africa. And as you heard, it hasn't been easy to manage TB in South Africa with the pandemic around. Restrictions and access to medication for TB patients was not easy. Them getting food was also not easy for them with the lockdown, the hard lockdown especially, and them being hustlers and not being able to go out and get food to provide for them so that they can be able to take medications. It has been very interesting, but also the theme for this year is that TB is curable. So if you go for the 6 months treatment, which is the set amount for TB, you can cure TB. As for the COVID-19, that's a story on its own. They have developed vaccines for it, but as for the cure, they are also still looking into that. And he did mention that you can get COVID while taking treatment for TB, and you also can get TB while on treatment for COVID, because obviously it's two different diseases and requires two different separate treatments. So you are not immune to either COVID or you're not immune to TB, but you can take precautionary measures in order to avoid getting those. And obviously with COVID, the most simple precautions that you can take is washing your hands, wearing a face mask, and keeping a safe distance. And with TB, it's almost similar, a cough in your elbow, open the windows for ventilation, especially if you are in a public transport, if you're traveling in public transport and you cannot really keep social distance, at least open the windows for ventilation. You can wear a mask as well if you have TB or you are afraid of contracting the disease. But there are also 3 different types of TB, and we didn't really get into that. There is vast information available on the internet, but since March is TB Awareness Month, we're going to get some more information on that as we get into or onto the 24th of March. If you have any further questions, comments, queries, or suggestions, please leave them in the comment section or send them to us on WhatsApp. The number is 061 766 0355. We will be right back.